Thank you for joining us, AACP member. My name is Fatima Ali, and I am the director of the Resident Teaching Certificate Program and an assistant professor at Roosevelt University College of Pharmacy in Schaumburg, Illinois. Today, I will be discussing our Pharmaceutical Care Lab activity, a Non-Prescription Therapeutics poster symposium. My course co-coordinator for Pharmaceutical Care Lab 2 was Dr. Cara Brock. Dr. Brock is the Director of Professional Labs and a clinical instructor at Roosevelt University College of Pharmacy. During this presentation, I will explain how to design a pharmaceutical care lab activity that simulates a professional poster session. I will also discuss on how to evaluate students' non-prescription therapeutics knowledge and their poster presentation skills. As part of this lab activity, we held a poster workshop, which occurred during regular class time. Our inaugural class has 66 students, and the students are pre-assigned into 12 groups with 5 to 6 members in each group. As part of this lab activity, the groups were assigned a non-prescription topic related to endocrine, pulmonary, or infectious disease. Students were provided directions on what to include on their posters, and they were also shown examples of what professional posters should look like. We included a link where students could access professional posters that had been submitted for a regional meeting. We discussed how a professional poster session is organized and how their lab poster symposium would be set up. The groups were then given time during this workshop to work and prepare their posters. Students were given directions to reiterate that these posters were meant more for patient education purposes and should be kept at a 5th to 6th grade reading level, and that medical jargon should be strictly avoided. We also emphasized that the use of appropriate and credible resources. We introduced the students to smart art capabilities of PowerPoint to make the posters more visually appealing to the audience. Students were also asked to use larger font sizes for the poster and to avoid complete sentences, but rather use a bulleted format for these posters. The topics assigned to the 12 groups are listed here. These included acne, allergic rhinitis, common cold, cough, emergency contraception, over-the-counter contraception, insect bites and stings, minor burns and wounds, pediculosis, sunburn, smoking cessation, and finally, blood glucose monitoring. The students were given examples of suggested poster sections, which included introduction and background on their particular or assigned non-prescription topic, pathophysiology associated with their disease state, signs and symptoms, exclusions for self-therapy, non-pharmacological therapies to treat their particular disease state, non-prescription therapies, and also a references section. In particular, for the non-prescription therapy section, the groups were asked to provide detailed drug therapy information, but in a patient-friendly terms. Students were expected to include medication name, dose, route, frequency, precautions and contraindications, and also some major counseling points for each of the medications that they discussed. The class was also provided with instruction on how to prepare their posters and asked to use the Roosevelt University College of Pharmacy templates available on makesigns.com. Students were given instructions on how to save their posters and then have them emailed to the faculty for their review a few weeks prior to the symposium date. The groups were expected to send the final version of their posters 1 week prior to the symposium date for printing. On the day of the symposium, the room and posters were set up by faculty. Students were given the first 30 minutes of that class time to practice their poster presentations. The poster symposium was then scheduled for the remaining 1.5 hours of that class time. Audience included students from other colleges at the university, faculty and staff, and ICL from the Schaumburg campus. ICL is the Institute of Continued Learning, which are students over the age of 55 at the Schaumburg campus of Roosevelt University campus. Faculty panel graded students using a rubric that was provided by the course coordinators. Feedback was provided by the clinical faculty to the students on their poster content and the presentation. This picture shows what the poster hall looked like. All the 12 group posters were spread out in a U format all around the room so that the audience could walk easily from one poster to the next. The grading rubric was given to the clinical faculty that graded the students is shown here. It highlighted all of the sections that the students were expected to include, including background, pathophysiology, and self-treatment. In addition, students were also graded on their presentation skills in terms of the written content, their poster display, and their communication skills. The top 3 posters were displayed at the college in the lab for the next couple of terms. The first place poster is shown here, which was on the topic acne. Second place was on blood glucose monitoring. This poster has been used multiple times since this poster symposium for health care related events by the students, such as health fairs. Third place winner poster was on minor burns and wounds. Again, emphasis was placed on the use of smart art, patient-friendly language, and bulleted format for these posters. The Nonprescription Therapeutics Poster Symposium was well appreciated by the students and the audience. Majority of the students were professionally dressed, but there were a few students that were asked to put on their lab coats to make their attire look a bit more professional. All posters included relevant sections with accurate information that had been reviewed by faculty. This lab activity provided the students with their first opportunity to experience a professional poster session, and also for some, their first opportunity to educate the public on non-prescription therapeutic topics. Thank you for joining us to learn more about this lab activity on Non-Prescription Therapeutics Poster Symposium.